Cleft lip and palate. So what is cleft lip and palate? It is splits or openings in parts of the mouth, such as the roof of the mouth and or the upper lip. It is caused when an unborn baby's facial structures do not completely close. And being that this is what it's defined as, there is also a role of genetics that comes into play. And so it can be inherited through genetic conditions, which is obtained from parents carrying the gene for cleft lip or palate. However, this gene can be passed down but not yet activated until interference with an environmental factor. So this is in a different instance in which environmental factors such as alcohol, drugs, cigarette usage, also vitamin deficiencies, and taking certain medications is what can trigger the cleft lip or palate. That being said, there's also difficulties that come with cleft lip and palate. One of them being speech, which, if left untreated, it can affect the production of sounds and speech overall, specifically the inability to produce labial and dental sounds. However, this also causes distortion in speech with glottal stops, mid-palatal stops, pharyngeal fricatives, pharyngeal stops, and many more. There's also difficulties that come with feeding, and so those with cleft lip and cleft palate that isn't untreated can experience nasal regurgitation when feeding. So this means that when they're eating, instead of the food going down properly, it comes up through their nose, which obviously we all know can be pretty uncomfortable. And then the following difficulties for cleft lip and palate include dental-related difficulties as well as ear infections and hearing loss. There are also several risk factors that come with cleft lip and palate. So family history is a big contribution to this, and so that it can be passed down through parents or other family members, which I did mention before, through the genetic defect. There is also diabetes, which entails that women with diabetes who are pregnant have a greater chance of having a baby with cleft lip or palate. Now, this does not mean that every single woman who has diabetes will also have a child with cleft lip or palate, but being that they do have diabetes, this does put their baby at a greater risk for having cleft lip or palate. Then there's also substance exposure, which is a more well-known risk factor, and this comes with a lot of other disorders, diseases, and so the likelihood increases for a child to have cleft lip or palate when a woman drinks, smokes, or take other forms of substances during their pregnancy. And then there's also obesity, which I wanted to include because I actually did not know this had any role in having a child with cleft lip or palate, but it does say that the likelihood for a baby is increased for mothers who are obese. So then, along with the risk factors, there are also prevention methods that can help a worried mother. So one prevention method is speaking to a genetic counselor to determine your risk. Now, there are a few mothers that like to do this before their child is born to test the risk of them having cleft lip or palate along with other diseases or disorders. And so another one includes avoiding the use of tobacco or alcohol use. Now, this is pretty general, and I did mention this before, but no mother should really be smoking or drinking during their pregnancy, even though there are mothers who do. But avoiding the use of these substances can help in preventing your child from having cleft lip or palate. Now, the last prevention method is just simply taking your prenatal vitamins, which a mother should be doing anyways. But just highlighting this key point is taking care of a mother's health. You're also taking care of your baby's health, and you're preventing them from having anything wrong with them. So lastly, there are treatment methods, and the only one that I really included is surgery because that is the main treatment for cleft lip or palate. This is a deformity in the face, so it really can only be treated by surgery. So for most babies, it's fixed through the course of many surgeries, and this happens usually after birth when a doctor will look at them, see if they're a candidate for surgery, and then do the proper work that is needed. And then I just wanted to include a picture of cleft lip and palate, which has been displayed throughout the presentation. But I just wanted to highlight now that you could see on the left side that there is a cleft palate, an opening in the palate. And on the right side, we have both cleft lip and palate. The cleft lip is the split in the lip at the top. Sometimes it even connects to the top of the nose. And not all cleft lip and palate looks like this. Obviously, there's many different forms. Everybody's different. Everybody will have a different cleft lip and palate, but this is just basically the general idea of what it looks like. So thank you for listening today, and I hope you enjoyed my presentation.